Hi, my name is Dr. Mary Gregory, and I'm an eye doctor that specializes in children's vision and early vision development. I wanted to talk a little bit today with you about your child's vision. A lot of times we think that babies are maybe born knowing what to see and that their vision is developed already. And actually, babies are born not knowing how to see. And that process of learning how to see has to develop in the brain, just like the ability to walk and talk as well. So that process happens between birth and 5. So this is a really critical age and time to make sure your child and your baby's vision is on track. Just like a child is learning at that same age how to walk and how to talk, they are actually learning how to see. Vision is in the back of the brain here, is processed back here. So information coming in each eye has to wrap through the brain and meet up back here. Because there's two eyes, there's always a possibility of a competition. And that is the leading cause of a vision problem in children in the United States. The reason this is such a leading area of problems for children's vision is because your baby can't tell you what they're seeing or not seeing. Even a toddler or preschool doesn't really know how to tell you any different. They don't know any different. And as a parent looking at your child, they're going to look like they can see everything. Sometimes I hear this all the time. Parents come in and say, my baby, they can find every plane in the sky. My child can. They find every little thing in the carpet. That may be true, but they might be using one eye more than the other, and they might not even be using the other eye. And so we want to identify those problems early on. Also, just like your baby is learning how to walk and doesn't just get up and walk one day, they have to meet all these different developmental milestones. And that's what your pediatrician is checking along the way when you go in. And there are the same kind of vision milestones that we're looking for as well. Unfortunately, they're really hard to identify on your own in everyday life. Sometimes you might see a child that maybe has a little eye turn, is extra clumsy, is rubbing their eyes a lot. Then we want to make sure that we're getting them in early. But actually, all babies should be checked at an early age. We like to recommend that babies are seen between the ages of 6 and 12 months old. There is a program that's a nationwide program called infantc.org. And what they do is help to educate and provide information to the public about the importance of early eye exams. There are also hundreds of optometrists across the nation that volunteer our time to do free, no-charge infant exams between the ages of 6 and 12 months. You can find a provider in your area on their website and get a lot of information too on just simple things you can be doing to make sure that your baby is getting lots of stimulation for their visual system early on. That website is www.infantc.org. INFANTSEE.org. I definitely recommend you getting on, putting in your zip code, and seeing who's available in your area. The next time we like to see kids for a full real eye exam is 3 years old. That's about halfway through vision development. We can pretty much determine if they're on track, if there's looking like there might be any areas that we need to work on. Certainly whether they need glasses, but also whether their visual skills are being met and developed at the right pace. The next time we like to see children for an eye exam is kindergarten, then first and second grade. Those are really critical early school years and reading years, and we want to make sure they are not having anything holding them back vision-wise in reaching their full potential. Not only in just their vision and can they see the board, but even much more importantly, do they have the stamina in their vision to stay focused up close so they're not having any attention issues? Can they keep both eyes pointing at the words and following along in the right order? Or are they getting mixed up? Are they skipping words? Are they struggling to remember what it is that they're taking in through their visual system? So there's a lot of work visually that needs to happen in order to sit in a classroom and to see, to read, and then also to comprehend and remember and process information. Vision is primarily neurological, and so there's a lot of work going on in the brain to not only intake information through the visual system, but also to process it. So those are great years to come in and get a full routine eye exam. Following that, your eye doctor will let you know if your child has some concerns and needs to be seen yearly, or if they can go every couple of years after that point. For more information on children's vision, there are a couple websites you can look up. Again, the infancy.org is a great one. The American Optometric Association, AOA.org, is also a great one. And then COVD.org is got a lot of information on vision development. That stands for the College of Optometrists and Vision Development, and there are lots of links and information and education on that website as well.